Thresholds mean different things to different people. I think the value of a threshold in itself is that it helps focus the conversation. And it does help to, in a sense, put a stake in the sand to say, this is one way of thinking about how much more we should be willing to pay for an added clinical benefit to patients. You can always let decision makers judge that for themselves. And in a very kind of pluralistic health system like the US, you might assume that some payers or some health systems, maybe even some consumers or patients, have different thresholds for what they are willing to pay or how they would like to allocate the resources. But having one threshold, in a sense, helps treat different conditions fairly, similarly across those different conditions, because intuitively there's no reason that we should automatically assume that we should pay more for a patient with heart disease than for someone with a neurologic problem, or vice versa. So thresholds kind of throw that conversation fairly across different treatment areas. And also, if you're looking at drugs or devices or different kinds of changes to the healthcare system, it puts those on the same playing field as well. So it's not by itself a definitive answer that you just kind of write down and then people walk away, but it's a way to stimulate and focus the kinds of conversation about value that we want to have with all stakeholders at the table.